Hi everybody. Welcome back to my channel. This is Dr. Connors and we are chatting today about a vaccine. All right, so as you know, Moderna and also Pfizer, I believe.
Yeah.
Okay, they are promising that, there's promising results from the clinical trials that the efficacy of the vaccine is about 96% in clinical trials. So it is very promising. So of course, a lot, as it's very promising and it's very hopeful, and a lot of people are very excited about it. But of course, majority of the people are also skeptical about it. Okay, so of course, as a consumer first, and then before being a scientist. As a consumer, it's I'm having difficulty for me, probably taking the first slew of vaccine, because usually a vaccine, it takes about 5 years to develop. So, but we are under new circumstances, giving under the, of course, the obvious, the pandemic. So the vaccine was developed so rapidly, within the wraps around of about 6 months. And so, of course, it's, as a consumer for me, I'll probably have a difficulty. I'll have difficulty getting the vaccine at first hand. It is not a cure. Okay, it's just going probably to, it's going to slow the spread of the virus. And then, if people are going to okay, the vaccine, the cure is here. That's not a cure. It's a vaccine. It's just like the flu. You get vaccinated yearly. And then, you get the vaccine again next year. It's not gonna be forever. Me, having lupus and also myasthenia gravis, my immune system is already compromised. It's probably not a good idea, but of course, I don't have any data or a study to cite for that. But for me personally, I probably feel uncomfortable taking the first slew of vaccine. So I know friends of mine who have, doctors, my colleagues who have gone into these clinical trials, and they have, and they have explained to me that actually they have the antibodies. So it was very promising. So it's more likely that it's really good for the healthy ones. Okay, but for me, the best bet still is to follow public health measures as we are doing now. Social distancing and also wearing the mask. Why is it that it's a problem to wear the mask when all you have to do is just wear it when you are around people or inside a building, okay, inside enclosed environment. Again, it's not a big deal. It's not a big deal to wear a mask. So it's just mandated when you are around people. Okay, and then, okay, so the cases in the United States, they are increasing, they are not decreasing. And it seems like we are again in this second phase of the pandemic. It's almost as if we have become relaxed. When facilities opened, we have become relaxed, and it's not wearing a mask. It's not an infringement of your liberties and freedom. I swear, it's not, I have worn the mask even before the pandemic. because of the fact that I was afraid, my oncologists were afraid, that I would cut something. So now that there's a pandemic, it is more like, it's not just protecting yourself, it's protecting each other. Okay, we have to think about each other. I just don't understand. Look, I don't want to wear the mask too, because look, I have beautiful lipstick. No one can see it. Okay, and it's really, really hot when you go inside. It's really hot.
And somebody mugs you, you can't.
I said, and it's. But these are special circumstances. These are special times, and we should not make wearing the mask a political stance. It should not be like that. We should at least care for each other, because you know what? It's not, we are not each other's enemy. This virus is not fake. It's not a hoax. Okay, the rates of cases are not fake. It's not inflated. They are not inflated. Doctors and hospitals are not getting extra money, okay, by inflating the rates of cases. So there is, doctors are not getting extra. They're not getting paid extra for that. Okay, what they are getting extra is extra work and extra time off from their own family, because they have to be isolated from their own family once that they are exposed to COVID patients. So I'm just really having difficulty. It's like, I know this a vlog is usually personal, but now as a doctor, as a public health doctor, I feel like I have the need to impart, professional stance about this. Okay, so first of all, we are all very excited about the vaccine. Okay, and that it's going to be the end of the pandemic. I don't think it's going to be the end of the pandemic once that we're good vaccinated. Okay, so it's just, I don't think that we're gonna be protected from the virus. Probably, I would say that is a temporary solution. But I think that wearing the mask when we are around each other, it should be the norm. I know that but these are special times, and I really don't see it ending soon. With the rates of cases increasing daily and deaths daily. Okay, so, and I just don't understand it, why we have to politicize wearing masks. Look at countries that they have mandatory mask wear. Okay, so they don't have as many cases.